would like today to talk about a very common condition which we as doctors and particularly as gynecologists are seeing more and more often over the last few decades. This is across the world, this is probably one of the commonest reasons why people are visiting the gynecologist chamber. And between the years of about teenage years to throughout the reproductive age group, basically, women may come with this condition called polycystic ovaries. And but of course it's much more common in the younger people. So we get many adolescents, teenagers, 20-year-olds, and apparently for various reasons this condition is on the rise across the world. Whether it is in the developing parts of the world or it is in the developed parts of the world, polycystic ovaries are certainly increasing in number. Now the point is, polycystic ovaries are not exactly a gynecological condition per se. There is a gynecological element to it, which is why most women will come to a gynecologist chamber. But the origin is, it is a metabolic condition, predominantly a metabolic and endocrine disorder. What we call an endocrine disorder, that means a disorder of the hormones, probably originating from the hormones coming from the brain. So we say the hypothalamo-pituitary axis produces hormones which ultimately affect all the endocrine glands through the body. The problem in polycystic ovary is it is a combination of these hormones which are being wrongly produced in the pituitary and metabolic conditions, which are ultimately leading to polycystic ovaries. The polycystic ovary is just a sign which for common people we say polycystic ovary. It is an sonographically recognized feature where the ovaries are polycystic, but actually the condition is much more deep set. It is a metabolic and endocrine disorder. So the polycystic ovaries that we see are an incidental finding, but the etiology is the metabolic problem and endocrine problem. That means the hormone problem. And therefore all our management has to be addressed to such. So therefore when we say endocrine problem and metabolic problem, the metabolic problem is basically a condition we call insulin resistance. We know that insulin is a hormone in the body, and we find and is very important for glucose metabolism, sugar metabolism. In this condition of polycystic ovaries, we have found that insulin resistance is present. That means basically that the body is producing insulin, but the body is not, the target organs are not being used, are insensitive to the circulating insulin in the blood. This condition is called insulin resistance, and we have found that the majority of people with polycystic ovaries have insulin resistance. And the moment you have insulin resistance, it is associated, mainly associated with obesity. Polycystic ovaries classically associated with obesity, insulin resistance, elevated blood glucose level, and at a later stage in life, many more of them are liable to develop diabetes mellitus, among other endocrine conditions. So this is a problem. So now we need to recognize that it is not really a gynecological problem of only polycystic ovary, but much more deep set endocrine disorder, metabolic disorder. We also, and it is on the rise, we realize that perhaps the lifestyle that we are having now is encouraging it to go on the rise. So therefore, what do we mean? Therefore, perhaps the poor exercise, poor diet, sedentary lifestyle, these are the reasons why there is a rise of polycystic ovarian syndrome, and this is also, we find a rise in diabetes mellitus also across the world. We know that the incidence of diabetes mellitus is rising. So this is exactly the similar condition, incidence of polycystic ovaries is also rising. How does a patient come? Generally the patients come to us with various complaints. For instance, the teenagers might come with acne and excessive hair. They might come with less periods, scanty periods, what we call oligomenorrhea. Then once the lady gets married, she might come to us with failing to fall pregnant. And of course, there will be a large proportion who will also be obese, and that will be their predominance. So accordingly, the treatment, we manage the girls or the ladies depending upon the presenting complaint. So obviously, if she has come to us with less, in scanty periods, or this treatment will be slightly different from someone who has come to us with a problem of acne and excessive hair growth, and also different from someone who has come with perhaps infertility. But the root of all the treatments should be a change in lifestyle, and therefore should include diet and exercise and weight reduction. This is the basis of all the management, because the maximum of polycystic ovaries, ladies suffering from polycystic are overweight. And therefore, no matter what their other symptoms are, the reasons why they have come to the gynecologist's chamber, whether it be infertility or infrequent periods or excessive hair growth or acne, but basically the treatment is directed towards weight reduction, because only by weight reduction do we actually direct our treatment to the main source of the problem, that is insulin resistance. So that in that regard, we put these ladies on a proper diet, calorie controlled diet, on a proper exercise regime, and the drugs, like there are certain drugs like metformin classically, which is also added in people who, in spite of a diet and exercise, are not being able to lose weight. We add metformin, a drug called metformin, which improves the problem of insulin resistance. So this is in a nutshell an overview of polycystic ovary, which is really becoming a more and more common condition. It is very related to the lifestyle that more and more youngsters are having, which is sedentary lifestyle and poor diet, fast food, etc.